Hello, everybody. Welcome to the Bristol Poverty Institute conference, Poverty and the Sustainable Development Goals from the Local to the Global. My name is Zoe Tumpakari. I'm a lecturer in Nutrition and Behavior Change at the University of Bristol and will be chairing today's session on food insecurity and malnutrition. My co-chair today is Professor David Gordon, Director of Bristol Poverty Institute. We have two wonderful speakers today, and before I introduce them, a few words of housekeeping. This session will be recorded and posted on our YouTube platform and embedded in the Bristol Poverty Institute website. By attending, you're consenting to be part of this recording. Please ensure that you have added your name rather than being listed as guest, as the BPI team will be monitoring attendees, and we also want to make sure that we know who is asking questions to our speakers. We will host a panel discussion at the end of both presentations, but please post your questions as early as possible. You don't have to wait until the end to do that. You will be able to ask questions via Zoom's Q&A function, which you can find at the bottom of your screen. Due to time constraints, we may not be able to answer every question, but please feel free to get in touch with the speakers after the session to continue conversation. I'm sure they will be delighted to, if you're interested in their work, or you can link up with them at one of the virtual networking sessions. The chat function that you see at the bottom of your screen will be disabled, so please don't use that. Use the Q&A function. Please be respectful. All events at this conference are being monitored, and we reserve the right to remove attendees whose comments are deemed offensive or derogatory. So that's enough of housekeeping. I'm delighted to introduce our first speaker. He's Professor Hugo Malcar Quinones, a Margaret A. Gilliam Scholar in Food Security with an appointment in the McGill School of Dietetics and Human Nutrition. Professor Malcar Quinones has conducted research in over 20 countries and maintains a strong collaboration with the United Nations Food Agriculture Organization. And his talk today is about the double burden of food insecurity and malnutrition and beyond. Really exciting topic. So Professor, when you're ready to start, please feel free to do so.
Many thanks. I want to thank the organizers for the invitation. I'm very pleased to be here. And I am going to start sharing my screen with you. We have a long way to go. I was thinking about starting sharing with you that the topic I want to cover today is sort of conceived to go beyond what we call the double burn, but I will certainly talk a bit more about that term. In this first slide, you can see my contact information. Just please feel free to contact me at any time. So briefly, when we talk about food security, this is the international consensual definition of food security, when all people at all times have physical and economic access to sufficient, safe, and nutritious foods in order to meet their dietary needs and their food preferences, with the goal of having an active and healthy life. Food security has been defined also as a phenomenon with 4 different dimensions. The central dimension in this slide refers to access, which is the actual dimension incorporated in the definition from 1996 that I just shared. The other 3 dimensions refer to food availability, food utilization, and stability in terms of social, political, economical, and environmental stability. So thinking about the definition and the 4 dimensions, one can already realize how difficult it is to actually assess such a complex phenomenon, which on top of things has a very complex causality, within different layers of environment, which could be polluted, could be conflicted in terms of social environment, or could be characterized by a political environment that is, in some cases, unpopular. Different kinds of capitals, which I will not describe, have certainly an impact on other aspects that we determine or that we identify as the main determinants of food insecurity. Besides the complex causality of food insecurity, the consequences of food insecurity are also multifold. And in this scheme, which actually, is a simple view of the consequences, I highlight the double burden of food insecurity or of malnutrition, which is characterized by the coexistence of both undernutrition, especially chronic undernutrition, stunting, and obesity. Other consequences refer also to psychological and social issues that turn things basically back into this vicious circle of food insecurity that, as we know, goes round and round, and in some cases, very difficult to break or to turn into what we would like to see as a virtual or virtuous circle of food security. So basically, the initial slides in my presentation are meant to put people in perspective in terms of how complex the phenomenon of food insecurity is. Now, in terms of the assessment, since 2002, we have sort of a guide, not a guideline, but recommendations in terms of the main methodologies on how to assess food insecurity, which goes from A to E, starting with what we call the FAO balance sheets, which focus on basically caloric availability in the countries, which we hope will meet people's energy requirement. Other methodology refers to income and expenditure surveys, which are meant to assess or to identify those who are in poverty. The third methodology refers to dietary intake. The fourth methodology to anthropometric assessment, mainly in terms of the anthropometric assessment in children. And the fifth methodology relates to what we call food insecurity experience scales. Now, the arrows in this slide are meant to show that if we focus or if we address food security, or we understand food security as people having access to the food people need, then the first two methodologies are sort of proxies in terms of assessing determinants of food security or food insecurity, while dietary intake and anthropometric assessment methodologies tap into indicators that will identify consequences of food insecurity. Thus, food insecurity experience scales have been conceived, are identified as the most direct measures, even though I must emphasize or remind us about the fact that there is no gold standard to measure food security, and each of these methodologies and others tap into the very complex framework that I just shared. A couple of years ago, 2014 actually, my colleagues at FAO and I published this paper on the validity and reliability of food security measures. And basically our central message refers to those food insecurity experience scales as probably the most promising tools among those that we have available to measure that phenomenon. From the last report, the state of food security and nutrition in the world by several United Nations agencies, I took this figure that shows that these food insecurity experience scales categorize food security and food insecurity in different levels, in different categories of severity of food insecurity, starting with the uncertainty regarding the ability to obtain food, all the way to the right when people experience hunger are not able to access the foods they need. So far, the United Nations agencies in this report or inform the public only about the two more severe or most severe categories of food insecurity, which are called moderate and severe food insecurity. But we distinguish also a category of mild food insecurity, which will come into play in a couple of the slides that I want to show you in terms of the relationship that has been found between this measure and what we call the double burn and of food insecurity and other issues. The other fact that I want to bring up quickly is that that report from 2020 reporting up to 2019 shows an increase at worldwide, relatively a slight increase, but still an increase of food insecurity from 2014, the date when the first time such a scale was applied at the global level, all the way up to 2019, where over 25% of individuals in the developing world, adults in this case, are facing either severe or moderate food insecurity. The UNICEF framework of food of malnutrition locates household food insecurity among the determinants or causes of malnutrition, and certainly this framework somehow relates to the one I shared with you before. In any case, household food security going through inadequate diet seems in this framework to be related not only to undernutrition but to other forms of malnutrition. The first time that my students and I were able to identify this relationship in a statistically significant manner was when we were exploring a data set from Colombia, where, as you can see in the right column of this table, the higher or the more severe food insecurity turns, the higher the probability of children to be stunted. Later on, of course, the question pop up, are in fact all those who are food insecure hungry and undernourished, or is there something else that relates to food insecurity? As I was working in California some years ago at UC Davis, looking at data on Mexican American children 3 to 5 years of age, I found that those who were categorized, or which households were categorized as food insecure, showed a higher prevalence of overweight when compared to those who were in food secure households. A similar thing applied to African American children in an analysis using national data from a nutrition survey. So basically what we were seeing here is that it's not only undernutrition as we understand that term when it relates to stunting, wasting, or underweight, but there was also something going on in terms of overweight and perhaps obesity. A couple of years ago, with the Mexican colleagues at the National Institute of Public Health in Mexico, we published this paper showing an increase, among all the results, an increase in the body mass index of Mexican adult women, an increase as food insecurity becomes more severe, measured again using the scales I mentioned before. A similar picture we found with adolescents in Mexico City, where the percentage of overweight was higher among those in food insecure households when compared to those in food secure households. Now, that seems to be part of the picture in terms of the coexistence, if we want, within populations of people being affected by stunting or undernutrition and overweight and obesity. Later in 2006, we had the possibility of running some quick analysis on demographic and health survey data from Brazil. And the picture you're seeing here is basically very similar to what I showed before in terms of an increased odds ratio for stunting as food insecurity turns more severe among Brazilian children. In the same survey, even though we couldn't do the match between the children and the mothers, women in that survey showed actually a higher odds ratio, not for undernutrition, but for obesity. So within the same survey, the same country, we found that coexistence of both stunting and obesity in relationship to different levels of food insecurity. Now, lately, using national data from the National Nutrition Survey from Colombia, one of my graduate students finished a thesis, which article we hope will be published sometime soon, showing that in fact, overweight and obesity in women seems to vary by food insecurity level, and very clearly child stunting increases with the severity of food insecurity. But we also found, and in this case, we were able to match children with mothers, stunted children with overweight and obese or obese mothers. And we found that for the moderate food insecure category, the percentage of that double burn was higher when compared to those who were food secure. So the existence of the double burn is within the same household, within a pair of mother and child, was established in this study, focusing actually on rural households of Colombia. Now, dietary patterns are certainly related to all these pictures that we have seen before, and it's no surprise to us that in terms of the types of diets that people are able to consume in Africa, over 70%, over 73% of people are not able to consume or cannot afford a healthy diet, when compared, for example, here to 3.7% of people in North America and Europe. These are data coming also from the SOFI 2020. Now, I brought up this picture because the quality of the diet, the consumption of a nutritious diet is in play. And one thing that I wanted to bring up as well is that different kinds of diets, especially a healthy diet, is not only less affordable for African people, but also more expensive in that continent when compared to North America and Europe. Big changes have happened throughout the world in terms of the dietary patterns again, and some foods have shifted, others or have marginalized other foods. I basically took some data from the stats FAO webpage and did this comparison between India or including India and Mexico, between the consumption and decreased consumption of pulses and beans and an increase in the consumption of refined sugar. So has been called as the triple burn adds to undernutrition and overweight, also the issue of micronutrient deficiencies. Diets that by food insecurity put people at risk of not consuming the micronutrients they need. In this data from Guatemala, we show again the differences in the expenditure of people in fruits and vegetables and dairy by food security level, and that would imply a higher risk for micronutrient deficiencies. Now, just as a contrast, that does not apply to the consumption of sugars or to staple grains in the same survey. Expenditures then on foods that are micronutrient rich, micronutrient dense foods are lower, as you can see here in the negative numbers, lower in the food insecure households when compared to food secure households, while the consumption of sugar, fat, and oils and cereals is higher, as shown in through these positive numbers. Something that applies also to North American populations, the consumption of, for example, French fries and chips as a percentage, as a proportion of the total vegetable consumption among American adolescents is much higher among those who are food insecure when compared to those who are food secure, which again could have an impact in their micronutrient status. Dietary diversity is clearly in this picture associated to food insecurity, a mild, moderate, and severe level. And my Mexican colleagues from the National Institute of Public Health developed here 3 categories of dietary diversity. As you can see, low dietary diversity increases as the severity of food insecurity increases as well. Now, with that, we have covered 3 of the burns that relate to food insecurity: undernutrition, overweight, obesity, and micronutrient deficiencies. But going beyond, there is something that has been, in terms of its relationship with food insecurity, not much explored, and has to do with food safety. In this brochure published by FAO, our colleagues state there is no food security without food safety. Unfortunately, very little, if any, research has been done to see if food insecure households do have or are at higher risk of exposure to unsafe foods. Talking about food safety, just in parentheses, a capsule. In February, this paper was published in Advances in Nutrition, where the importance of water security for food security, for good nutrition and well-being is discussed. And in this case, I would like to share with you that a number of colleagues have been working on what we call the Household Water Insecurity Experiences Scale, H-WISE, led by colleagues at Northwestern University in Chicago. I brought up food unsafety as the 4th burn. And finally, to wrap up this talk, sorry for going a bit over the time, I would like to bring up what I would call the quintuple burn of food insecurity, which refers to mental health. And in this paper, led by Professor Frank Elgar, with collaboration from many colleagues, among others, our dear colleague, Dave Gordon, the food insecurity and youth mental health and well-being from a global perspective is explored. And briefly, you can see here how mental health issues in youth by food insecurity level compares to those youth between 15 and 24 years of age who are food secure or mildly food insecure, and how positive well-being among those who are food insecure compares to those who are food secure or mildly food insecure consistently across many different regions in the world. My last slide goes back to this child. It's a picture of a girl that I took 21 years ago. Certainly when we did a diagnosis of her nutritional status, we realized she was already undernourished. 21 years later, I fear that she has been facing the other burdens of food insecurity. She might be dealing already with obesity or overweight and some chronic diseases. So with that said, I think that certainly an approach to overcome and to deal with food insecurity will need to take into account the complexity that I try to share with you through my talk. Many thanks, and again, apologies for taking a little longer time. Thank you.
Thank you very much, Professor. That was a very interesting talk, and you know, putting everything into perspective and sort of talking about the complexity. As I said, anyone who has any questions, please feel free to start posting them now, but we'll address them at the end of the session. So thank you very much. So I'm really happy to introduce our second speaker, Dr. Charlene Nandy, who is a reader in social policy at Cardiff University in the UK, and his work focuses on international development and the development of appropriate indicators to assess poverty and malnutrition in low and middle income countries. His talk today is about assessing progress toward SDG 2 in West and Central Africa. Dr. Nandy, the virtual floor is yours.
Thank you, Zoe. I just need to make sure I've got the right slide shown to people. Am I showing the right slide? Are you seeing my first slide? Thank you. We've only had a year to get used to Zoom. I apologize. Okay, thank you very much for the invitation. I'm going to kill my video because that's just distracting in the corner. Thank you for the invitation. Thank you, Dave, and to colleagues at the Bristol Poverty Institute for the opportunity to be part of the 6th. Gosh, it seems a long time since we had the first Townsend Memorial Conference in London all those years ago. So it's a real pleasure to be joining the group this time and listening into everyone else's talks. Before I get going, given we're talking about, or our colleagues have been talking about the consensual approach to poverty or socially perceived necessities, I thought when I was preparing this slide of showing some data from a paper that we did a few years ago, my colleague Marco Pomati and I in Cardiff. We found these data from the so-called the Core Welfare Indicator questionnaires from several countries in sub-Saharan Africa that asked what are very similar questions to those of you who are familiar with the socially perceived necessities approach about what items people felt in each of these different countries were necessary to maintain a minimum standard of living. And so I've highlighted here the food-related items and also the frequency of meals, but also the access to basic services such as water, to show that even 10, 15 years ago, what people thought were necessities which should be reflected in any meaningful or socially realistic measure of poverty should really include access to decent food of sufficient variety, as Hugo was saying. But I just thought I'd flag that there. The hyperlink at the bottom takes you to the questionnaires if you're interested in following up on that. So today I'll be presenting some work that my colleague Marco Pomati and I've done at Cardiff University. And I'm going to keep it simple, and I'm going to try and keep it quick so that we have time for a discussion at the end. I may fail dismally. I apologize in advance. I'm going to set out a bit about why we did what we did, and then mainly, and that background will present sort of examples from India, and I think it's India mainly, and then I will be presenting the main results of what we found when we were doing our analysis of multiple malnutrition in West and Central Africa. And I hope to sort of show some information about the prevalences, but also the numbers of children affected, some basic analyses on the drivers of these different things, and also an analysis of the change over time in the region. Yeah, the work that I'll be presenting has been written up and published in these two journals over here. And given our focus was on Western Central Africa with lots of Francophone colleagues, we ensured that, or we tried to make sure that it was published in a French language publication as well, which Statco is, and therefore is more accessible to people in the region. Okay, so a bit of background as to why we did what we did. Sadly, between while we were running up to the MDGs in 2015, Sub-Saharan Africa saw an increase of about nearly a quarter in the number of children experiencing stunting. For those of you who are not nutrition experts, and I am not a nutritionist or a nutrition expert at all, I'll be talking about the different measures that we use to assess malnutrition in young children. Hugo's talked a bit about them, but I'll give you a reason as to why we think some slight changes might be needed. But in that period, in the run-up to the MDGs, we saw an additional 58 million children experiencing 58 million children in the region affected by stunting across the whole of Sub-Saharan Africa. We know that several of the MDGs were not met in time, and that by the 2015 deadline, there were more people living in absolute poverty in 2015 than there were in the year 2000. The SDGs that replaced the MDGs set targets for tackling hunger and all forms of malnutrition, some of which you'll all be familiar with. But this time, instead of using underweight, which was the main indicator for the MDGs or the Millennium Development Goals, the main target indicators were going to be looking at wasting and stunting, particularly in young children. Hugo's pointed to a couple of more recent reports on the food insecurity and nutrition reports, but as early as 2017, it was observed that rates of stunting and wasting in young children were not falling fast enough in the region in order to meet the 2030 target date. So we're already playing catch up, and I'm guessing COVID hasn't really helped in terms of ensuring greater food security in the region. Now, for those of you who are not regular users of the nutrition data or nutrition indices, I'm going to be focusing mainly on anthropometric indices that people use. And the three main ones that are traditionally used or conventionally used are stunting, wasting, and underweight. Now, stunting expresses chronic or longer-term food or nutrition deprivation, where effectively children fail to reach an expected height or length for age, i.e. they're short for their age. Wasting is a second one. It's a measure of more recent or immediate food or nutrition deprivation or illness. And it's when children are not heavy enough for their expected weight, or do not have the sufficient weight for their height. So they're very thin children. The third measure that's been traditionally used is underweight, which is effectively low weight for children's age, where children are failing to reach an expected weight for their age, either because they're wasted or stunted or both. And as I said, underweight was the key indicator for assessing progress to the MDG with regards hunger. More recently, and with the SDGs, there's an interest in the co-occurrence of stunting and wasting, and also of overweight and obesity as well, given that these are considered to be indicators of a not healthy development. So these are the main indicators with which we should be familiar with: stunting, wasting, underweight. And I won't really be talking about overweight or obesity in this particular presentation, but I'm sure we can come to that in discussions later on. Now, in 2000, Professor Peter Svedberg was wondering about which measures, when we're talking from a policy perspective, which indicators should we be using when we're interested in tackling undernutrition or malnutrition at an aggregate level? And he thought, well, do I use stunting? Do I use wasting? Do I use underweight? Which of the three matter? And what he developed, and this is a picture of a very well-thumbed copy of my book, which I'd recommend people follow up on. It's available as a PDF online. He sort of said, what we're interested in is whether or not children exhibit deficiencies in any one of those three indicators, whether they have a low weight for height, whether they have a low weight for their age, or whether they have a low height for their age. So effectively, children in groups B, C, D, E, and F here, as he set out in his model. only children in group A or in section A of this particular chart were ones who had heights and weights expected for their ages, normal development, so to speak. And so when we did some work in 2004 now, I think, where we operationalized Svedberg's CIAF, this composite index of anthropometric failure, and applied it to data from India. We were lucky to work with Peter Svedberg a few years ago. And in applying the data, the approach to India, using the conventional measures, we saw about 48% of children, nearly half of children were stunted, having a low height for age. 43% were underweight, had a low weight for their age, and 20% exhibited wasting, had a low weight for their height. India, with a population of over 1.4 billion now, you get some idea of the numbers of children under 5 affected by these quite severe outcomes for child health and child nutrition. However, when we applied Svedberg's approach, what we saw was that rather than 48% or a minority of children stunted, we actually saw a majority of children affected, with 62% experiencing either stunting, wasting, and/or underweight. And this difference between 62% and 48%, or 43% if we look at underweight, was a difference of between 18 and 25 million malnourished children, which was quite significant. We are able to use Svedberg's measure to disaggregate the patterns of malnutrition across the population in those different groups which I've set out there. And the ones I'd like to draw attention to are groups C, D, and E, where we see children who are affected by a combination of different so-called anthropometric failures. Looking at group D, which shows 9% of children under 5 in India, roughly 11 million children, these were children who were experiencing simultaneous wasting, stunting, and underweight, which was quite a concern. Now, why do these matter? Well, it's useful, this type of analysis is useful because you can break it down to sort of look at the relationship between different combinations of, or different patterns of malnutrition and things like household wealth or household income. And using the index, the wealth index or the asset-based index on the NFHS data, we were able to show that, yes, those children with multiple failures certainly had the lowest wealth index scores over here. Surprise, surprise, poor children tend to have, tend to be the worst off in terms of malnutritional status. We looked also between the relationship between multiple malnutrition and morbidity. And again, using the same data for India, we're able to show the odds of having dysentery was highest for those children who were in group D, suffering from a triple failure, or in groups E, who were simultaneously stunted and underweight as well, with a 60% chance and an 80% chance greater than those with no failures of having dysentery, which is a major killer in many countries of young children. And we were also interested, but didn't do it at the time, between the relationship between mortality and multiple malnutrition. And luckily, someone else did that work. McDonnell and colleagues in 2013 published this pooled analysis of the hazard risks of all-cause mortality by different anthropometric failure group. And sure enough, they were showing an up to 12 times greater risk for of early mortality for children who were wasted, stunted, and underweight. And those mortality groups were much higher for those who are multiply malnourished. And so this was the basis on which we applied to the ESRC's GCRF secondary data analysis to sort of say, what does the picture of multiple malnutrition look like across sub-Saharan Africa? We had several aims to use and abuse the data, the anthropometric, the individual and household level data collected by the demographic and health surveys and UNICEF's multiple indicator cluster surveys that are collected on countries from around the world. We were just focusing on West and Central Africa, one of the poorest regions of the world. And we wanted to know, what did the regional picture look like of multiple malnutrition, given the relationships with morbidity, given the relationships with mortality. We also wanted to see how changes over time fared and what impact the global food price crisis of 2007 and 2008 had. And we also wanted to identify any sub-national geographic, economic, and socio-demographic factors associated with multiple malnutrition as well. On the left is just a standard map of Western Central Africa in terms of countries. And next to that on the right is a cartogram showing you sort of the area blown up to reflect the number of children in each country. So Nigeria and the Democratic Republic of Congo are certainly inflated because they have the largest number and the largest share of children in the region. And I'll come back to that cartogram later on. So in terms of our sample, I won't take you through all of them. We had 18 or 19 countries, some with multiple rounds of data, some with just the one round of data. So we were able to use the most recent data, those states with asterisks next to them were used for our 2010 estimate. But then when we were doing national trends, we used all the data sets available from DHS and MIX as part of our analysis. Okay, so a few key headline figures. If we're looking at the conventional measures of stunting, wasting, and underweight, we would see about 1 in 3 children, just over 1 in 3 children were stunted, 12% experienced wasting, and 23% reflected underweight. If we use the Svedberg measure, it was closer to half of 48% of children in the region were experiencing one or more forms of anthropometric failure. And our focus was the column that says multiple malnutrition, sorry, MM for multiple malnutrition, with around 1 in 5, 1 in 4 children affected by this multiple anthropometric failures. In terms of numbers, the differences were quite worrying, with around 15 million children across the region affected by multiple failures. Again, if we think about these children with a raised or a much greater risk of morbidity and mortality, then we're talking a much a sizable problem to be tackled by governments and UN agencies wanting to ensure child well-being. I'm sure Professor Gordon is having a heart attack at this moment with how the data are being presented. They are ordered by the number of children affected by the CIAF. So please, yeah, I mean, the most prevalent cases were for Niger, the lowest with Gabon and the Congo as well. Not the Democratic Republic of Congo, the next door, the Congo Republic. Okay. In terms of presenting the same data more simply, we're showing a cartogram again showing the bulk of the challenges in Nigeria and in the DRC. But then if we're looking at the extent and the prevalence of the not multiple malnutrition but aggregate malnutrition, we can see that in Benin and Niger, these are countries with particularly high levels of malnutrition. How is multiple malnutrition composed if we've got 22% of children across the region experiencing multiple malnutrition? What is the composition? What is the share of these different formats? And we see by far most of those children who are multiply malnourished are exhibiting a combination of stunting and underweight. That's the key driver that's the key format of multiple malnutrition in Western Central Africa. We thought, what else could we do with the data since we didn't? Okay, thank you for the 5-minute warning. We were worried about what the implications were for mortality, child mortality. So we used the DHS and MIX data on child mortality at national and subnational level, and we're able to sort of show the relationship between different rates of mortality, child mortality, and different forms of malnutrition, and again confirmed what McDonald and colleagues had found. We weren't using longitudinal data, we were using the cross-sectional data published by the DHS and MIX there. Again, I've put links to all of our papers where you can read more on this if you're interested. So what were the drivers that I mentioned that we would look at? Well, they were the usual suspects of standard of living, of low education, and slum conditions such as unimproved access to unimproved sources of water and sanitation, etc. Here we're looking at across the wealth index, higher rates of overall malnutrition for the poorest compared to the richest, for those with in both urban and rural areas, with rural areas of deprivation greater than urban ones. Same for the number of deprivations experienced by households, and again by levels of education, of maternal education. I apologize for the incorrect coloring in the final panel, but we are aware of that. But the legends are correct. In terms of change over time, well, sadly, we see nothing meaningful over time. In fact, we see an increase in the number of people experiencing either triple failure or a double failure, but also an increase in the number experiencing no failure as well, which I suppose is heartening. But in terms of percentage-wise, we're not seeing any meaningful change over this particular period. Most of the increase was witnessed amongst rural populations, but that said, there was an increase also amongst urban malnutrition across the region, with around 1 million of the additional 2.5 million children being urban residents. And most of these children are living in what we would define as slum-like conditions of overcrowding, of poor access to basic services around there. In terms of national trends, for those countries where we had multiple rounds, we're looking here at multiple malnutrition, and in terms of percentages wise or prevalence rates, it's not entirely good. If you look at Nigeria at the far right, we're seeing an increase over time. But on the hand, the picture in the region looks sort of not too bad with downward sloping curves in many of the countries. However, once you take population growth into account, what we're actually seeing is a massive increase in the numbers of children affected by multiple malnutrition. I've included on the slides at the very end, I won't show them now, similar slides for the aggregate malnutrition as well. So if we're talking about targets for the SDGs and countries trying to tackle stunting and wasting, we are in this particular region nowhere near on achieving what we want to achieve or what we need to achieve by 2030. My final slide won't tell you anything new. Education and poverty remain the key drivers of undernutrition and malnutrition in both urban and rural areas. Prevalence of this particular challenge is greatest in rural areas, but we need to be aware of the growing prevalence of this particular challenge in urban areas as well, because it has the capacity to undermine any gains made. Often urban areas do better than rural areas. We're not seeing that particularly so in the region, in this particular region. Population growth or high rates of population growth combined with only modest rates of reduction mean that regional progress is limited. And lastly, although I haven't really discussed it, we all know the impact of the pandemic has had on people's capacity to find food or secure food or to grow food or access food. The pandemic itself will certainly have an impact on food insecurity and resulting outcomes for children. Thank you.
Excellent. Thank you so much, Charlene. That was a very interesting presentation and right on time. Yes, Hugo, it's great to have you on camera as well. If you can please, from the attendees, anybody who has any questions, please post them at the Q&A function, and ensure that your name is showing, and also make sure that you specify who the question is aimed at, or if it's for both our speakers. And please be respectful in terms of your questions and comments. So we do have a first question by Cynthia Fonta. Thanks for the presentation, Dr. Nandy. Any link between climate shocks and undernutrition, like in a Sahelian country like Niger?
I was typing as fast as I could. It would be yes, in short, but it's not just environmental shocks that are affecting food security, in particularly Niger and the Sahel region as well. Conflict is also having an impact, and of course, ongoing and persistent poverty. People can be fed well, food can be flown in if we're trying to do it. It's not a long-term solution. The longer-term solutions are tackling poverty, ensuring conflict or civil conflict is prevented, and eventually investments in irrigation. I mean, no, it's mostly desert up there, but there are ways around it. Other places have managed to deal with that. But yes, environment is a big driver as well.
Excellent. Thank you for the answer. Any other questions?
Can I ask a question that was sent
Dave.
to me by email? The SDG goal 2 is to end hunger, and it includes targets to end hunger by 2030 and end malnutrition in all its forms by 2030. What do you think would need to happen for those targets to be achieved? And that's to both speakers.
I'll defer to Hugo first while I work on an answer.
Thank you very much, Charlene and David, for the question. Well, what needs to happen? One of the when I was listening to Charlene's response to the previous question, I was thinking about that little house that I draw for you on a slide, and I purposely put down as the foundation for that house the dimension of stability, and so we're talking about environmental stability, we're talking about social stability, we're talking about political and economical stability. But that's, of course, the big picture. I do think that one of the things we should do, perhaps starting with the academia, is to try to better understand where what has worked. And I am in Brazil right now. I got stuck here for personal reasons, but I arrived in Brazil for, about 14 months ago. And Brazil is one of the examples in terms of how to fight hunger, but also one of the examples on how to go the other way, right? How hunger can quickly increase. A couple of years ago, a Brazilian student and other of students in my group and I published a paper on the importance of political and economical stability. Brazil was able between 2004 and 2013, roughly, to decrease by 2/3 the percentage, the prevalence of severe food insecurity. Now, in a couple of years, we went back to where we were before 2004. And 2004 was the year when the program Hunger Zero, Fome Zero, by former President Lula started. And in 2015, an economical, political crisis started and brought us back to the Stone Age. So what needs to happen? Well, there is a lot that needs to happen. But perhaps the first thing is that we go beyond legislation that puts food security and good nutrition and well-being only on paper. Big investments have to be done. Brazil invested over 20 billion euros per year by 2009 in the fight against hunger. So that needs to happen as well. Political will, funding, right? Budgets that target hunger in the right way. But number three, just to close up, because some people ask me, what's your favorite of all of these? I think my favorite is social participation, community organization. Without that, and Brazil is an example, one more time, any hit from the forces against social and economical change will just erase all the efforts that have been done before.
Thank you, Hugo. Charlene?
Typical Dave. Big question, many answers. Thank you for throwing us that rugby ball. No, hospital pass. I agree with Hugo in terms of, it's no secret as to what needs doing. Very often the FAO point to the work that was done in Thailand in the 1980s in terms of supplemental feeding, birth registration, birth growth monitoring, all of those different things. One of the things that's been interesting to watch in Brazil, I have a vested interest in Brazil as well. My wife is, the boss is from Brazil. And when the Bolsa Familia and the food and Zero Fome, the Zero Hunger campaign came in, it was very interesting to see sort of the wiping out of, well, it was aimed to tackle hunger. What was the unintended consequence of that was for the first time people were accessing in huge amounts cheap calories, which have contributed to a rapid growth in obesity. For adolescents and for adults as well. And some work on the double burden we've been doing in Peru with colleagues from Crónicas Research Center shows how there's been a decline in stunting for Peruvian children, and obviously a simultaneous increase of obesity with mothers. And we're thinking, yes, the decline in stunting is fantastic, but is that on a downward trajectory towards overweight and obesity for the children? A rapid leapfrogging from of a nutrition transition from, okay, stunting was bad, but overweight and obesity are not good either. How do we sort of avoid that bounce is what I'm interested in. But yes, how do we solve that? All of the above. India still has 48% of kids malnourished. They have not tackled poverty for a large number of people, and that's probably what's driving it there. It's not a technical solution. We know the answers. Sorry, Hugo.
No, thank you. I was just thinking about what you said. Those are the downsides of poverty measures, right? And overweight and obesity are actually a global pandemic. Now, one thing to keep in mind, levels of stunting have been huge across countries like Peru, as you mentioned, Guatemala, Bolivia, and so on. Those stunted children don't turn into well-nourished children after 2 years of age. There's nothing we can do. They remain stunted. They start to eat more calories. And remember that at least for the calculation of the BMI as one of the indicators for overweight and obesity, the height is the denominator. And so every gram that people add to the function of weight by height, is just a higher BMI. So it's a combination of things. But certainly there is something. I mean, we're talking about food systems in many places, and in the end, I think we have a food system that is not fulfilling its function. It is not, and it's not providing people, supplying people with nutritious and safe food. Besides, of course, the quantities that we need.
Thank you both. Yeah, it is definitely sort of complex answers, and it was one question, but yeah, it took so much discussion. We have one more unanswered question. Where do we stand on food security measurement? Are we getting any closer to a gold standard? Anybody? It's not addressed to anybody. Hugo, I believe you touched on that in your presentation.
No, we are not, and we will not. We will not. I don't think we will. It's just we're talking about something that is extremely complex, starting with the definition and the dimensions and so on. So, but we don't need a gold standard. Actually, we don't need. We have measures that actually are very clear. A child is stunted. Well, that's a sign of food insecurity. A woman is dealing with anemia. That's most probably related to food insecurity. A person is poor. A person will be most probably food insecure. The countries are not producing enough food, then, and so on. And then on top of things, we have the experiences that people are reporting to us. So I honestly don't think we need a gold standard. And we will not have it as far as I can see.
Thank you for that. So we have 1 more minute to go. If anybody will post some quick questions. It's nothing.
If there aren't, one observation I'd like to make is the sort of the rapid increase in obesity amongst the rural rich, the rural non-poor. We're seeing that as food patterns change, people and living standards change, what we're seeing is a rise in obesity, even though at the absolute level it's lower than in urban obesity. The rate of increase in many countries is greatest amongst the non-poor rural population. So we need to be aware of that and think about our public health messages getting out to rural areas as well, not just focusing on the urban poor.
Absolutely. That's the thing. It's sometimes sort of overlooked, and as you say, focusing on sort of urban rather than rural. Thank you, Charlene, for this observation. And with this, we're just finished. So thank you both, Hugo and Charlene, for the wonderful presentations and thought-provoking presentations. Thank you to our participants for your questions. Just a quick reminder that this has been recorded. It will be available by the BPI website soon. The Bristol University Press also has created a virtual space so that you can connect, and they're also offering you 50% off a selection of their latest books, as well as free content from the Journal of Poverty and Social Justice. You can find the link on our 4 Waves event website. So later, if you're interested, there are discussions on food, nutrition, poverty, and SDGs, Beyond Zero Hunger at 3:30, and also a networking session at 5:30. So do check out the program for links. And please do engage with the online discussions via our Twitter account at Bristol Poverty and BPI Conference 2021 hashtag. Thank you, everybody, for the session.